So what does a clicking joint really mean? The lower jaw mandible connects to the head at this point called Temporo Mandibular Joint, and this part is called the condyle. The socket part of it is really part of the temporal bone, which forms part of the skull. In between them, there's normally a cushion that cushions between the ball and the socket, if you would, and the cushion or the disc is held in place by ligaments on top of this condyle. If they are stretched out, damaged, so now there's a slack, the disc is really out of place because there's a tiny muscle called lateral pterygoid that pulls it out of place, especially when the disc is loose because the ligament is stretched on long. So it gets pulled out of place and kind of towards the center normally as the teeth are together. However, as the jaw opens a certain amount, the slack gets used up, so the disc pops into place. At that point, from the rest of the way as the jaw opens, the disc is actually in place. However, as we close the jaw, right before the teeth come together, it slips out of place, often without making a lot of noise. So when the disc teeth are completely together, there is no cushion between the ball and the socket, between the condyle and the fossa. This is technically called dislocated disc with reduction. No one with a good understanding will say this is actually normal. Is it common? It is often common, but so a lot of things are common, including death. That doesn't make it optimal or desirable.